Well, thank you very much to Peter and the team for this opportunity to talk to you about another alphabet soup. I'm sure that being part of the Clark is always sort of very interesting when you're trying to explain to people what it all stands for. And I have some sympathy for that because working for the EAHSN, and I stumble over it as well, it's not easy to say. You kind of wonder what all these alphabet soups are going on about. And hopefully at the end of this talk, you'll leave with a little clearer understanding of what academic health science networks and specifically what we're trying to do in the East is all about. I'm going to start with a little bit of a backstory. I don't know whether anybody in the room remembers a paper being published called Innovation, Health and Wealth. Does anybody sort of remember that sort of a couple of years ago? Big thick paper from NHS England, but with two quite interesting, important sort of key messages within it, really. The one, I guess, reflects some of the frustration that I was hearing in the sort of conversation during the course of the morning about the fact that we have this great evidence. Very frustrating when that evidence isn't translated into action. And the paper Innovation, Health and Wealth was making the point that it's true that for most innovations, whether they're products or services, it usually takes about 17 years as a number that's often quoted between it being proven, it works, it's being in operation in one part of the health service, to it being widespread sort of use. So 17 years, so I might put things in perspective sometimes with the frustrations when some of the work that you're doing doesn't seem to be kind of put into action quickly. The other key message from the paper was on about economic growth. So the paper made the point that this country is absolutely fantastic at creating innovation. We've got some brilliant academic institutions, we've got some very creative people that come up with great innovations. But very often, those innovations hit a big stumbling block when they try and commercialise them. And the NHS is a very tricky customer. And we see many companies choose to go overseas when they're moving into that kind of early commercialisation space. So there was a piece there from the economic growth perspective that was sort of making the point, well, how can we capture this great innovation and do something for the economy of the country? And that was, I guess, the backstory behind academic health science networks being formed. And we're one of 15 across the country that was set up a couple of years ago. So what I thought I would do today is try and do three things. So one was to give you a little bit of sense of what we're working on and the priorities. And the second is to talk specifically about joint working on patient safety. And at this stage, I'm going to ask Caroline just to stick her hand in the air there. So Caroline is working full-time on our patient safety program. So if you're interested and inspired by the talk, then please, talk with Caroline, afterwards. And fortunately, our full-time director, Susan Went, is on a plane at the moment, so isn't with us today. And then, I guess, through most of the talk, I'm going to be kind of alluding and referencing to how we can work better together, because there's one thing is absolutely clear. When you look at our sort of purpose and mission, which is up here, there's a lot of alignment really between what the Clark is trying to do and what the Academic Health Science Network is trying to do. So our purpose, we're driven by two things, healthcare and economic growth. And although appreciate that most people in them were probably more driven by healthcare than economic growth, there is an important part of the Clark, as I understand it, where one has to evidence back to the centre what one is doing in terms of connection with industry, and so there is also a spirit of economic growth within the Clark objectives. We're a very small organisation. The resources that we have are pretty similar to the resources that are deployed to the Clark. So we can do some stuff ourselves, but actually we can do a great deal more if we work in partnership. And our interests in partnership are with health, social care, and we've got the same objectives of you at the end of the day to try and improve people's lives. So that's the purpose of the organisation. And we're working on 6 things, and I just concentrate, if I may, attention on the top 4 of those on the slide. And these are at different stages of evolution. So some of them are very early. Some of the things we're only just starting to look at. And one of those is vanguards, new models of care. I mean, clearly off the 5-year forward view, and lots of chief executives, lots of boards of different organisations, and lots of clinicians playing leadership roles are all kind of reflecting on the future of health and how we can deliver health in more efficient ways, new models of care. And so for the Academic Health Science Network, we're reflecting on that. And our thinking at this stage is that, there are two areas that we can add some value in. One is in evaluation. Well, where do the resources sit within evaluation? Well, the expertise sits in this room. And the other sort of area is about spread of knowledge. So, trying to prevent the sort of the pilot syndrome of hundreds of different things happening and people not knowing what's going on elsewhere. So, diffusion and spread of knowledge. So that's something we're looking at, which is fairly fresh, and we're kind of still very open. And I'd love to receive ideas and thoughts and, ideas how we can approach that. The second of those objectives is quite mature. So when the Academic Health Science Network was established, most of the resources were deployed to 7 clinical study groups. One of them is on patient safety, and the others were fitted on. We looked at different particular areas of medicine. And most of those study groups are now coming towards the end of their fruition, and those clinical study groups are battling in some ways with many of the same problems that I heard being articulated during the morning about, got some great innovations, but how do we get widespread, spread and adoption? The third area is one I'm going to concentrate on this talk, because it's an area where I think we formally agreed it's a shared priority. It's complete overlap in terms of the strategy of the Clerk and the strategy of the EHSM, which is about safety. So I'm going to talk a little bit more about that. And then the last piece is about partnership. And, again, that's, an important piece. You're a partnership-based organisation. We're a partnership organisation. So, there's a lot in common with that. The last two are much more about sort of, in that kind of sphere. So again, like the engineers, thought it would be worthwhile sort of bringing things alive a little bit, and just quoting an example of something that came out of one of the clinical study groups. And there's quite a lot of parallel, I think, between this story and some of the stories that we heard earlier on this morning. I mean, this was an example where a group of anaesthetists, based in King's Lynn, saw a simple problem, which is that, there was a high risk of never events occurring where people, rather than taking blood samples out of the interior line, injected into the arterial line and causing a never event. So a group of doctors, with that insight, developed a very simple connector to deal with that problem. And they've received support from all sorts of places, including the Academic Health Science Network, Health Enterprise East, and other grants. And those people collectively putting their arms around this group of doctors has led to the fact that this product has been developed and it's now being tested in a number of hospitals around the East. It's a really simple example of where an insight has led to a product, and we're in the middle of supporting those anaesthetists to turn this into a business and spread and adopt the diffusion. The one thing I thought I would share with you, because it's a little bit connected with the discussions earlier on about this frustration about why are things not being spread and diffused. We asked the Nuffield Trust organisation to do a little bit of external review, and they did a series of interviews with the clinical study groups and pulled out the learnings, and they're on those bullet points on the slide. And I guess many of you might kind of look through those bullet points and sit there and think, well, can't I know that, or I know some of that, because certainly that was my kind of reaction. But the challenge, as I think we were talking about just earlier on before I started the talk, was that it's often done at the end. People think about spread and adoption diffusion at the end of a research project or at the end of a sort of a thinking process. Whereas one of the things that's very clear in my mind is that you have to do it before you start doing anything. You have to really think that through. The other key thing that I think was consistent was that the engagement with CCGs just was not where it needed to be. CCGs hold the purse strings. They hold that kind of role, within the health system as much as anybody about trying to look at the local health systems. So that was a big learning for us in terms of really strong engagement with CCGs. So I'm now going to turn to talk about the Patient Safety Collaborative, because that's something that we share in common as a priority. PSCs were introduced after the Berwick report, which you can probably know, was one of the things that cascaded out of the Francis report. And one of the things they recommended was that the NHS takes a more systematic approach to how we drive sort of safety. And a little bit part of funding was made available sort of nationally, and the HSN's matched that funding pot to create a system of 15 patient safety collaboratives. And we started working on it here in the East in October. And since I've been involved over the last few months, this, to my mind, feels like it's really picking up pace and momentum. What we're trying to do is focus on a couple of areas. So, one is we picked a particular cohort of patients, and I guess it will come as no surprise to you that this is the cohort that we picked. It's the area that's the biggest, creating the biggest demand in the health service and facing one of the biggest sort of challenges. And on that slide, you can see our kind of working definition. And we're looking both at some pathway things and we're looking at some sort of process things. But the first thing that we are kind of focusing on, our first sort of implementation sort of phase starts with leadership, because one of the learnings, from all of these reports is that we need to get the leadership right. And, next week, in fact, we've got the boards of 4 different trusts spending a day and a half focusing on strengthening their leadership, And we're working in partnership with Aqua on this. Now, that's a pretty big commitment if you think about it. I happen to be a non-exec director in another life, for Foundation Trust. If somebody were to come to me as a non-exec director and say, I want a day and a half of your time to sit in a training course, I'd need a hell of a lot of persuading that that was a good use of the very limited time that non-execs have. And so it's a very good sign, I think, within this system, within the East, that it was relatively easy for whole boards to decide that they want to spend that time on that area. And we're going to be developing that, hopefully, with boards across the East. And we're very interested as we move forward. These are trust boards, and we've done it with trust boards because it's kind of a little bit easier, they're more established. But our intention is to do this in future with combined CCG, trust CCG, so health economy levels. So we not only strengthen the leadership within individual institutions, but look at it at a system level as well. And we're hoping that kind of platform with the relationships we build and the emphasis that safety will be placed, therefore, within boards, not that it isn't already, but it shows you that the sort of leadership commitment could potentially help support the work that you're all doing in terms of safety as well. The other thing that we're doing is with respect to education, sort of spread of knowledge. So I'd like to invite you all, if you'd like to join us on the 23rd at Newmarket Racecourse. And this is an event where we're just trying to now start this sort of encouragement and sharing the spread of knowledge, the spread of adoption. And so this again is an opportunity, where, for those of you involved in safety, if you have knowledge, we'd love to hear from you. We'd love to, provide you with, support with your work in terms of, improving how things move around the system. Those are some specific things, but on a more general sort of note, Peter and I think, made a commitment that we're going to work very hard to bring these programs together. So, from the stakeholder perspective, it doesn't look like they're dealing with lots of different alphabet soups when it comes to safety, but they're seeing a coordinated system level, wide approach, between us. So that's, I guess, really coming to the end of what I wanted to say. A little bit about style. I hope you find, when you engage with us, you'll find us, collaborative. We would be very interested if those people are interested in connecting with industry, to engage in dialogue with you. We have, quite a big platform, about 300 companies that have engaged with the EHSN over the last sort of couple of years in various ways. So we might be able to sort of create connections in that regard, or maybe even support, companies that you might be working with. And we're focused on tackling the most pressing issues. We try and work, fast. And finally, we're very interested in measurement and therefore, and economic outcomes, and therefore another kind of alignment with the clerk. So that's really it, and I guess I now wanted to sort of, open it to the floor to, give you an opportunity to ask me questions or to learn myself, actually, because, these are the sort of things that we're thinking about by way of collaboration. We'd love to do more. So I would love to hear any ideas or thoughts that you might have in terms of how we can do that. So I shall pass back to you, Tony.